Welcome. This is the New England Journal of Medicine. I'm Dr. Michael Bierer. This week, August 15th, 2024, we talk about osimertinib in Stage III EGFR-mutated lung cancer, cognitive motor dissociation in disorders of consciousness, rapid deployment of a brain-computer interface in ALS, and the longevity of a brain-computer interface for ALS. A review article on the genetics of chronic kidney disease, a case report of a boy with autism and decreased vision, and perspectives on medical expertise, on collecting data on sexual orientation and gender identity, and on the pursuit of polka dots. Osimertinib after chemoradiotherapy in Stage III EGFR-mutated NSCLC by Shun Liu from the Shanghai Jiao Tong University, China, and co-authors. Osimertinib is a recommended treatment for advanced non-small cell lung cancer, NSCLC, with an epidermal growth factor receptor, EGFR, mutation, and as adjuvant treatment for resected EGFR-mutated NSCLC. EGFR tyrosine kinase inhibitors have shown preliminary efficacy in unresectable Stage III EGFR-mutated NSCLC. In this Phase 3 trial, 216 patients with unresectable EGFR-mutated Stage III NSCLC without progression during or after chemoradiotherapy were randomly assigned to receive osimertinib or placebo until disease progression occurred or the regimen was discontinued. Osimertinib resulted in a significant progression-free survival benefit as compared with placebo. The median progression-free survival was 39.1 months with osimertinib versus 5.6 months with placebo. The percentage of patients who were alive and progression-free at 12 months was 74% with osimertinib and 22% with placebo. Interim overall survival data, maturity 20%, showed 36-month overall survival among 84% of patients with osimertinib and 74% with placebo. The incidence of adverse events of grade 3 or higher was 35% in the osimertinib group and 12% in the placebo group. Radiation pneumonitis, majority grade 1 or 2, was reported in 48% and 38% respectively. No new safety concerns emerged. Treatment with osimertinib resulted in significantly longer progression-free survival than placebo in patients with unresectable Stage III EGFR-mutated NSCLC. Natasha Lale from Princess Margaret Cancer Center, Toronto, writes in an editorial that Liu and co-authors report results that establish maintenance treatment with osimertinib after chemoradiation therapy as the new standard of care for patients with unresectable Stage III EGFR-mutated lung cancer. As we implement this new standard, what challenges do we face? First, routine biomarker testing must be performed in all patients with unresectable Stage III EGFR-mutated lung cancer in time for treatment decision-making. A second key consideration is the toxic effects of treatment. Thoughtful selection of patients, prompt diagnosis, and early management of pulmonary complications are needed to minimize toxic effects in routine practice. A third challenge is treatment duration. Could a shorter duration of therapy still lead to benefit with fewer toxic effects and lower patient burden and cost? Fourth, are these results generalizable to real-world patients? Fortunately, we have learned that it is the tumor mutation, rather than the patient's ancestry, that predicts treatment benefit. However, greater diversity in clinical trials is essential. Finally, are we curing patients with maintenance osimertinib? Or are these results merely indicative of very costly lead time bias with earlier treatment of subclinical metastatic disease without longer overall survival? The magnitude of the progression-free survival benefit is clinically meaningful and important for patients, as is the reduction in intracranial relapse. Liu and co-authors have raised the bar with the use of maintenance therapy with osimertinib in unresectable stage III EGFR-mutated lung cancer, a new standard that brings patients closer to a cure. Cognitive Motor Dissociation in Disorders of Consciousness by Yelena Bodian from Spaulding Rehabilitation Hospital, Charlestown, Massachusetts, and co-authors. Patients with brain injury who are unresponsive to commands may perform cognitive tasks that are detected on functional MRI, fMRI, and electroencephalography, EEG. This phenomenon, known as cognitive motor dissociation, has not been systematically studied in a large cohort of persons with disorders of consciousness. In this prospective cohort study conducted at 6 international centers, the investigators collected clinical, behavioral, and task-based fMRI and EEG data from adults with disorders of consciousness. The investigators assessed the response to commands on task-based fMRI or EEG in participants without an observable response to verbal commands, that is, those with a behavioral diagnosis of coma, vegetative state, or minimally conscious state minus, and in participants with an observable response to verbal commands. The median age of the participants was 37.9 years. The median time between brain injury and assessment with the Coma Recovery Scale revised was 7.9 months, and brain trauma was an etiologic factor in 50%. Among 241 persons with disorders of consciousness who had no observable response to commands, 25% had a verifiable response to commands on EEG or functional MRI. Cognitive motor dissociation was associated with younger age, longer time since injury, and brain trauma as an etiologic factor. In contrast, responses on task-based fMRI or EEG occurred in 38% of 112 participants with an observable response to verbal commands. Approximately 1 in 4 participants without an observable response to commands performed a cognitive task on fMRI or EEG, as compared with 1 in 3 participants with an observable response to commands. An Accurate and Rapidly Calibrating Speech Neuroprosthesis by Nicholas Card from the University of California, Davis, and co-authors. Brain-computer interfaces can enable communication for people with paralysis by transforming cortical activity associated with attempted speech into text on a computer screen. Communication with brain-computer interfaces has been restricted by extensive training requirements and limited accuracy. These authors report on a 45-year-old man with amyotrophic lateral sclerosis, ALS, with tetraparesis and severe dysarthria, who underwent surgical implantation of 4 microelectrode arrays into his left ventral precentral gyrus 5 years after the onset of the illness. These arrays recorded neural activity from 256 intracortical electrodes. The authors report the results of decoding his cortical neural activity as he attempted to speak in both prompted and unstructured conversational contexts. 25 days after surgery, on the first day of system use and after 30 minutes of cortical recordings while the participant attempted to speak, followed by subsequent processing, the neuroprosthesis achieved 99.6% accuracy with a 50-word vocabulary. On the second day, after 1.4 additional hours of system training, the neuroprosthesis achieved 90.2% accuracy using a 125,000-word vocabulary. with further training data, the neuroprosthesis sustained 97.5% accuracy over a period of 8.4 months after surgical implantation, and the participant used it to communicate in self-paced conversations for more than 248 cumulative hours. In a person with ALS and severe dysarthria, an intracortical speech neuroprosthesis reached a level of performance suitable to restore conversational communication after brief training. Longevity of a brain-computer interface for amyotrophic lateral sclerosis by Mariska van Steensel from the University Medical Center, Utrecht, the Netherlands, and co-authors. Motor and speech impairments that prohibit communication develop in persons with amyotrophic lateral sclerosis, ALS. The durability of communication with the use of brain-computer interfaces in persons with progressive neurodegenerative disease has not been extensively examined. These investigators report on 7 years of independent, at-home use of an implanted brain-computer interface for communication by a person with advanced ALS, the inception of which was reported in 2016. The frequency of at-home use increased over time to compensate for gradual loss of control of an eye gaze tracking device, followed by a progressive decrease in use starting 6 years after implantation. At-home use ended when control of the brain-computer interface became unreliable. No signs of technical malfunction were found. Instead, the amplitude of neural signals declined, and CT imaging revealed progressive atrophy, which suggested that ALS-related neurodegeneration ultimately rendered the brain-computer interface ineffective after years of successful use, although alternative explanations are plausible. In a Science Behind the Study editorial, Edward Chang from the University of California, San Francisco, writes that the findings of Card and co-authors represent a new performance milestone for speech neuroprostheses. Although the speed of speech was approximately 32 words per minute, word accuracy was very high, with an error rate of less than 5% on an open vocabulary of words. To put this into perspective, this performance approximates the accuracy of modern speech recognition systems, which are trained to transcribe audio into text sentences. The decoder could learn rare words and could be trained rapidly and recalibrated online, which has not been shown previously. Perhaps most important, Card and co-authors provided evidence of real-world usage, in which the speech neuroprosthesis was used in interactive conversations. However, an important consideration is that the patient with dysarthria studied by Card and co-authors had higher residual intact speech function than participants in most previous studies, which have mainly focused on paralyzed patients with anarthria. Nonetheless, this study suggests that speech neuroprostheses may have benefits in a large population of patients. A long-standing challenge of microelectrode arrays is cell loss and long-term stability. Van Steensel and co-authors report on the longevity, safety, and use of a brain-computer interface in a woman with severe paralysis. The goal of the treatment, which was successful, was not to decode speech, but to allow a participant to deliver click commands for spelling and to call her caregiver. For several years, she relied on the brain-computer interface for communication. In the later years, however, the performance of the brain-computer interface decreased, and this was attributed to the progressive neurodegeneration of ALS. This study raises questions about the long-term performance of brain-computer interfaces in patients who have progressive neurodegenerative conditions such as ALS. The ideal interface device will provide high-performance decoding and reliability over the long term, at least a decade, which will require that it be fully implantable, wireless, with a large bandwidth to capture information-bearing cortical signals that are critical to decoding. In addition, the device should be easily implanted and explanted without injury to the brain. Genetics of Chronic Kidney Disease, a review article by Asaf Vivant from Edmund and Lily Safra Children's Hospital, Tel HaShomer, Israel. Chronic kidney disease, CKD, is a public health challenge that affects more than 800 million people worldwide. CKD can be caused by a variety of disease processes. Many causes are difficult to identify with the use of traditional clinical diagnostics, and precise causes often remain unknown. The Kidney Disease Improving Global Outcomes Organization recently highlighted the importance of genetics in the classification and management of CKD and advised clinicians to consider genetic testing in order to improve diagnostic accuracy and facilitate personalized medical management in nephrology. This review discusses the diagnosis and management of CKD of genetic origin. Patients with CKD should be referred for genetic consultation and testing when indicated. Obtaining a variant-level molecular diagnosis is important, even when the clinical phenotype-based diagnosis supports a specific genetic cause. Genetic molecular diagnoses establish precise causes with clinical implications for personalized monitoring, if available, and treatment, and for effective genetic family counseling. The most common monogenic CKD diagnoses worldwide include pathogenic variants in PKD and COL4A. Pathogenic variants in many other genes account for the remaining genetic diagnoses. Some CKDs have complex genetic determinants, with the risk of disease dependent on genotype, such as the genotype of ApoL1, and environment. Even patients with negative results of genetic testing should be periodically reassessed as novel risk variants are identified and as genetic tests become more available and informative. A 12-year-old boy with autism and decreased vision, a case record of the Massachusetts General Hospital by Eric Geyer and co-authors. A 12-year-old boy with autism was admitted to the hospital because of decreased vision in both eyes. 6 weeks earlier, the patient began to have difficulty seeing in both eyes. His vision was decreased when he woke up in the morning, improved throughout the day, and worsened again at night. 3 weeks before the current admission, the patient told his parents about the vision changes. They took him to an optometry clinic for evaluation. Eyeglasses were not prescribed. A routine follow-up was scheduled. During the next 3 weeks, the patient noticed that the decrease in vision worsened. On the day of this admission, the patient woke up screaming and panicked because he could not see. His parents brought him to the emergency department. The patient had autism and ADHD. He had developmental delays in speech, language, cognition, and fine motor skills. The patient's parents described him as a picky eater. The patient avoided trying new foods and did not take vitamin pills or gummies because he disliked the taste or texture. In this case, careful attention to the patient's description of the vision changes provided clues to the diagnosis. Darkening of the vision is not typical of corneal, lenticular, or cortical processes, but it is a common descriptor used for disorders of the anterior visual pathway, retina, and optic nerve. Nutritional optic neuropathy and retinopathy manifest with symmetric, painless vision loss that is gradual and progressive. Selective eating is common in patients with autism and has resulted in nutritional deficiencies associated with disorders affecting the optic nerve and retina. Blood tests revealed deficiencies in vitamin A, copper, and zinc. The patient also had severe deficiencies in 25-hydroxyvitamin D and vitamin C. While the patient was in the hospital, he received supplements of vitamins A, C, D, and K, as well as calcium, thiamine, copper, and zinc. His nutrient levels eventually normalized. However, unfortunately, the patient's optic atrophy was severe. This severe degree of vision loss is generally irreversible when it is found at such an advanced stage. Medical expertise. Balancing Science, Values, and Trust, A Perspective on the Fundamentals of Medical Ethics by Baron Lerner from the New York University Grossman School of Medicine. A 75-year-old man visited his primary care physician, who told him that a new COVID booster would soon be available. The patient told the doctor that, while listening to conservative radio in order to hear opposing opinions, he had learned that one was more likely to die from side effects of the COVID vaccine than from the disease. The physician summarized the available data about the safety and effectiveness of vaccination, but the patient was reluctant to agree. At first glance, this physician's reaction makes sense. He used his expertise, that is, his special skills and knowledge of the topic, to try to inform his patient's decision-making. But over the past half-century, as was made especially clear by the COVID pandemic, patients have increasingly challenged their physician's expertise. Merely providing patients with data and advice has become an inadequate way to disseminate information and promote informed consent. It is helpful to explore this history. How and why did the expertise of physicians, which is also tied into concepts such as authority and trust, get called into question? Although social and political factors have always played a role in determining what constitutes expertise, the growing polarization in American society has led to a crisis in medicine and public health. Rather than assuming that expertise can be restored with better data, we need to understand in a non-judgmental way how patients process both information and misinformation. Such knowledge can help restore the trust that was once the backbone of physician expertise. SOGI Data Collection, Proceeding but with Caution. A Perspective by Carrie Kandrian from the University of Colorado School of Medicine, Aurora, and co-authors. For more than a decade, the Joint Commission has recommended the routine collection and use of sexual orientation and gender identity, SOGI, data as a way to help the medical community understand and address the disparities that lesbian, gay, bisexual, transgender, queer, and intersex LGBTQI+ people experience throughout their lifetimes, and especially when seeking health care. Other institutions have joined this call. Despite this groundswell of support, SOGI data still aren't routinely collected or utilized in the U.S. healthcare system. According to the U.S. Department of Health and Human Services, collection of SOGI data is important for two primary reasons. First, it supports the understanding of disparities associated with the intersections of race, age, gender identity, and sexual orientation. Second, it ensures that health promotion efforts and services for LGBTQI+ people can be more precisely directed. Essentially, SOGI data collection is necessary to ensure quality and access in healthcare. These authors believe health professionals and researchers need to proceed with SOGI data collection, but should do so with caution. Collecting these data from all patients could help destigmatize sexual and gender minority identities. Several actions will be important. First, questions about SOGI could be routinely included on clinical, research, and administrative forms. Such questions need to be presented in a sensitive, safe, and respectful way. Second, data collection could be coordinated among agencies. Third, non-discrimination policies must be enforced by applicable local, state, and federal agencies. In Pursuit of Polka Dots, a perspective by Charlotte Hayes from the Mayo Clinic, Rochester, Minnesota. 4:15 a.m. Charlotte's morning migraine arrives right on schedule. She grabs an emesis bag from the stack on her bedside table and throws up. After taking her litany of medications, including 2 oral chemo drugs, Charlotte hops to the kitchen. She retrieves a filgrastim injection from the refrigerator, administers it, and deposits the syringe in the nearby sharps container. Every seasoned cyclist has experienced the dreaded bonk at least once. It's typically a self-inflicted form of misery, physiological retaliation for the failure to fuel. When asked to describe her journey with cancer, Charlotte finds that the term Chronic bonk is the most accurate response. It's a protracted and severe depletion of mental, emotional, and physical energy, the type of exhaustion not remedied by copious amounts of sleep or nutrient-dense food. In preparation for the day's 4-hour chemo infusion, lumbar puncture, graduate course exam, and presentation, Charlotte clothes herself in armor, chamois shorts, a breathable base layer top, and a form-fitting Lycra cycling jersey. The paper-thin material of this supersuit offers little to no protection for the rider, but it's the most appropriate attire for the title she's pursuing. Charlotte is after the polka dot jersey. Adorned with vibrant red polka dots, it is the most distinctive jersey of the Tour de France. Awarded to the rider who emerges victorious on the mountain stages, it symbolizes the strength to endure. Though the wearer often doesn't win the yellow jersey for the overall race, this cyclist is the toughest when the task is most grueling. Charlotte sits down and puts on her newly minted prosthetic leg. The microprocessor knee has a cycling mode that allows her to adjust the resistance to accommodate steep climbs and zippy descents. The hydraulic foot affords her the range of ankle motion needed for a smooth rotary stroke and seamless clipping in and out of the pedals. With most of the town still asleep, Charlotte reaches the trailhead to begin the ride. She is physically stuck to the bike, but she is freer on 2 wheels than she ever was on 2 legs. The noise of the world falls away as she gets up to speed. No beeping heart monitor, no smell of rubbing alcohol, no scratchy hospital gown. In our Images in Clinical Medicine, a 58-year-old man presented with a 2-year history of eyelid lesions and several months of weight loss and fatigue. Scattered periorbital petechiae and purpura were noted, as well as coalescing waxy papules on the eyelids. A final diagnosis of AL amyloidosis associated with lambda light chain myeloma was made. In AL amyloidosis, infiltration of vessel walls by amyloid results in vascular fragility. In another image, a 70-year-old man with rheumatoid arthritis presented with painful red lesions on the right side of his penis and scrotum and on his inner right thigh, and a 1-day history of difficulty urinating. A diagnosis of herpes zoster of the genitals complicated by acute urinary retention due to postherpetic visceral neuropathy was made. The skin lesions in herpes zoster are classically portrayed as clustered vesicles, but they may manifest as grouped or confluent erosions, as in this case. This concludes our summary. Let us know what you think about our podcast. Any comments or suggestions may be sent to audio@nejm.org. Thank you for listening.